Welcome everybody to everything you always wanted to know about health insurance.
This should be short.
Now, wait a minute. The only people watching this video want to know how to choose the right healthcare plan for them.
You got a point there. Let's get started.
Yeah.
You made a soundtrack?
Nothing wrong with setting the mood.
Okay.
MPR Midwest Public Risk provides 3 kinds of health insurance options. HMOs, Health Maintenance Organizations, Open Access Plus plans, those are PPOs, and our consumer-directed health plans under the Choice Fund. Humana manages the HMO, and it's only for the Kansas City area and the counties around us. Cigna manages the other plans.
I've got this one, Dave. Usually in an HMO, you don't need to pay a deductible. That's the amount before your benefits kick in. But there's a group of doctors that make up the HMO's network, and you can only use your benefits when you see those in-network doctors.
So, if your doctor isn't in Humana's network and staying with that doctor is important to you, the Humana HMO may not be your best option. You can check online for a current list, but be aware that you don't need to choose a primary care physician anymore, like you had to in some HMOs. And you don't need a referral to see a specialist. Just make sure all your doctors are in the network.
What about hospitals?
Most of Kansas City area hospitals are in the Humana HMO.
Okay, well, what if I break my leg in a roller derby accident and there's no Humana HMO nearby?
You're taking up roller derby?
Just trying to keep it interesting, Dave.
Okay. In a true emergency, you can go to any hospital, and the claim will be paid like it's in network, with the same emergency room or inpatient hospital copay.
Oh. What's a copay again?
It's a fee you pay for services. That's what you pay whenever you see your doctor, or in this case, when you go to the emergency room. The amount varies depending on which plan you have. The copay is always higher when you go to an emergency room because it helps people use the emergency room just for emergencies.
So in this HMO, what other services have copays?
Primary care doctors, specialist visits, prescriptions.
That's one heck of a dictionary. And checkups? Whoa!
Cost you nothing. Preventive care is covered at 100%, so there's no excuse not to have checkups.
You gotta love a free mammogram.
Who doesn't? If you do get sick, there are copays for inpatient or outpatient care at Humana Network hospitals. Urgent care has copays too, but they're a lot less than the ER.
What about benefits when you're out of town?
Unless it's a true emergency like your roller derby broken leg, your insurance won't apply.
So, if you're covering family members who travel a lot or live outside the area,
maybe an HMO isn't the best option for you.
Good thing we've got another video for them to watch.
Now you're really getting into this, aren't you, Kim?
These people have placed their trust in us, Dave.
And in MPR.